The coronavirus pandemic is forcing college students to adapt to a new normal. And while these changes may help keep them safe, it could also impact their mental health. The NBC News social news gathering team spoke with some mental health professionals and college students coping with these new challenges.
The pandemic has really made my mental health a lot worse. This is the most anxious I've ever been, I think, in my entire life, just with everything, kind of like school and then managing my time, trying to get things done while I'm also freaking out about how bad the pandemic is.
We also have some data that's come out more recently that's suggesting that there's been a particular impact on college students, that they're seeing higher levels of depression, they're having financial insecurity, which is also leading to mental health problems. And this is concerning because before the pandemic, we knew that college students were increasingly having mental health concerns. So now you add the pandemic and we have a population that's particularly in greater need for mental health services.
I would say for me, before the whole pandemic, started, I was going through a really tough time personally, and kind of falling into the whole pandemic, I just kind of said, I'm done. I give up. Why is this happening?
A lot of just the stress from my family falls on me because I am basically the oldest and I speak the language, and my parents help me out with my tuition, and so I feel like I owe them a lot, and then they feel like I need to help them a lot.
Many of our students have backgrounds that are fraught with frustrations and challenges and so forth.
My parents are very staunchly Republicans. I'm bisexual, bipolar. I'm also very progressive. I had a sociology and anthropology minor. Obviously, those are going to come up with some progressive topics. And I had to very strategically hide what I was doing. I have to hide the books that I read. Again, it's not nearly as bad as not having food or being abused, but it is a stressor.
Our data showed that more than half of students didn't know where to go for mental health services in the onset of the pandemic, and 20% of students were experiencing significant negative impacts to their mental health during that time. So that's definitely something that's very concerning to us.
Through the student health services, they have counselors that we can talk to online. It was nice to be able to get to talk to someone about the things that were going on. But because I was at home, even if I was home alone, it was kind of hard to be as vulnerable as I was in their office, just because there was a different feeling there.
I think about this group of college students not coming back to college because they're not coming back to anything. They're coming into something very new. And I like to think of it as them being kind of unintended or unexpected explorers. And so I have a lot of hope in this generation. And even though I'm concerned about them, I'm also excited to see what they do with this moment that's all their own and unlike any that any of us have ever experienced.
The CDC is moving to ban evictions nationwide through the end of the year, saying increased homelessness would be a national health hazard that could make the coronavirus crisis worse. Dr. Bob Lahita joins me now. Dr. Lahita is the chairman of the Department of Medicine at St. Joseph's University Hospital in New Jersey. Dr. Lahita, we've seen over the course of this pandemic that poverty puts people at risk for coronavirus. What impact could this eviction freeze have on the current situation? What's it going to mean if people are kicked out of their homes?
Well, if people are kicked out of their homes, it could be a problem because homelessness is a major issue in the country. In certain cities, it's epidemic, if you will. And the pandemic runs through communities where there's a lot of homeless lying on the streets. Of course, it's very difficult for homeless people to keep safe distancing and also to wear a mask and do the things the rest of us do, such as wash their hands. So this eviction prevention, if I read it correctly, is a good thing to keep people safe and at least able to self-quarantine and protect themselves from further infection. It's a very good thing that I think I see.
Let's talk vaccines. Dr. Fauci said again today we could have a vaccine by the end of the year, but a lot of Americans are skeptical about the safety of vaccines. What are you looking for to know if a coronavirus vaccine is safe to take? And also knowing that a lot of us are hearing that there could be this sort of like emergency use thing that happens from the FDA as it's in the last stages of trials, but before it's really gone through the whole thing or been published in this peer-reviewed journal. What does this mean? Is it safe?
Yes, this has created quite a commotion. First of all, let me say, Savannah, that 40% of Americans don't want to be vaccinated. And that's one thing that's a big problem. Second thing is that the vaccine, once approved via phase 3, may require 2 injections. That's like a month apart. And that's another big issue because, you know, people aren't going to really like the first shot. And if they get a few aches and pains like some people get with the flu vaccine, they're certainly not going to line up for the second vaccine. So the second shot is to boost the immune system and make sure you have anti-COVID antibodies. Now, I can say generally that the vaccines that I've seen developed are superb. They're in phase 3, and phase 3 means at least 30,000 people here in the United States to be tested against placebo. So placebo means sugar water. So antibody injection or genetic injection, depending on which vaccine you use, versus sugar water to see the efficacy or the ability of the vaccine to work. Now, around the world, there are approximately 50 million people. 50,000 people will be in phase 3, and then later hundreds of millions of doses of the vaccine will be available. I think that the CDC or the FDA right now with its emergency use authorization is saying that perhaps people who are at greatest risk, such as our elderly with a lot of comorbidities, such as people in the healthcare industry, such as doctors, nurses, and people working in hospitals, conductors on trains, bus drivers, EMTs, paramedics, all of those may get this emergency use vaccine, meaning it would be given before the phase 3 efficacy trials are finished. Savannah?
All right, and Dr. Lahita, now let's talk about some of the things that we all miss doing, going to restaurants, going to gyms, and if you think they're safe. In your home state of New Jersey and the county that I'm in California, indoor dining is partially reopening this week. In your view, is it safe to go out to eat right now? Maybe do you think it's safe specifically inside versus outside? What do diners need to know?
I think diners need to know that if they're in an area where there isn't a spike of infections, it's okay to eat inside if you wear a mask when you go to sit down, if your waiter or waitress is wearing a mask, the maitre d' wearing a mask, and you keep your distance from the other table. And I have been dining outside with my wife, and we've noted that tables have been at least 6 feet apart. I don't wear a mask outside, neither does she. And we're very comfortable. And so far, knock on wood, it's been fairly good. We've been fairly safe. Indoor dining, we presume, will be the same thing. Good ventilation, good air conditioning is extremely important. You don't want to be in a stuffy, hot room with a table that's 2 foot away from you with a crowd of people that are yelling or singing or trading beers or drinks, etc. That's a prescription for disaster. And that's what young people tend to do. And that's why we have such a surge of infections between the 20 and 40-year-olds right now in the southern part of the country. Savannah?
Dr. Lahita, thank you so much for your tips on that. Makes me smile to hear that you and your wife are doing a little bit of that. Thank you so much and stay safe.
Thank you. You too.
The coronavirus outbreak at the University of Alabama is exploding. Over 1,200 cases reported since the semester started. NBC News correspondent Ellison Barber joins me now from Tuscaloosa, Alabama. Ellison, you hear that? I know classes have not been going on for very long, just a couple weeks. Over 1,200 cases does not sound good. Tell us more about this outbreak.
Yeah, I mean, it's 1,200 cases among students at the University of Alabama. And the crazy thing is that 87% of those cases came in a span of just 8 days. Now, school officials, they will say when you look at the total number of the student body population here, this is a huge school. They have over 30,000 students here, that it's a relatively small percentage. But then you look at the rate of how quickly these numbers have come. I talked to one professor just yesterday who said theoretically at the rate they're going right now, you could have a situation if things don't change where almost the entire student body has been impacted or infected by COVID-19 once the fall semester comes around. A big concern for a lot of people right now is they're worried. Thankfully, no students have had to be hospitalized because of this, but they're worried that other people in the community here in Tuscaloosa, Alabama, could be impacted by this outbreak, especially if the numbers keep going in the direction they're headed right now. Savannah?
And Allison, how are the students feeling about this? How are they reacting? Are they scared? Do they feel okay? I mean, it's obviously good to hear that none of the students have been hospitalized, but I mean, there's still an outbreak going on campus. What are they telling you?
Yeah. I mean, it's interesting. There's a big mix of reactions here. Almost everybody will say that they're concerned by the numbers, but some people say, they really shouldn't be here on campus. They either say the school should have waited a little longer to bring students back, or they think that the numbers show that it hasn't worked and that it's time for people to go home. Some also say other students need to be doing more when they're outside of the classrooms to protect each other. Some say they are thrilled to be back, and they say they see the safety protocols that the school is doing here. They've seen the plexiglass in classrooms. They see students wearing masks when they're inside, and they say they feel pretty safe here and they want to stay. Here's a little bit more of what we've heard from students as we've tried to stop them walking through the campus.
I think that the university had a well thought out plan, and they're still working on it every day with the situational response team as well as the task force that President Bell has. They look at numbers every day and make sure that it's safe for students to stay on campus.
I just feel like they're not being very transparent with the thought process behind the scenes. They're thinking about, collecting the tuition, making sure all the dorms are, paid for and everything.
Bringing us back on campus is like begging for COVID to come hang out.
Kind of a big question for students, regardless of which side they fall in the discussion here, whether they feel like the school is doing a good job or if they feel like it's time to go home. No one really knows what will happen next, and that's sort of what everyone is kind of waiting to see. There's been no indication from the university if there's a certain number where they would say, okay, it's time for us to change course. For now, they say they feel like they're flattening the curve some and moving in the right direction, but when you look at those numbers, Savannah, it's hard to see where that's happening so far.
Listen, I like the way that last student put it, inviting COVID to just come hang out. I mean, it is kind of crazy thinking about them all being there on campus together. That's also then impacting the staff, faculty. What do employees think there? It's not just the students on a university campus.
Yeah, so we have talked to a lot of faculty members and also staffers, teachers, teaching assistants. And what we're hearing from a lot of them is that they feel like they are being silenced or intimidated into silence by the university when they're trying to speak out about some concerns they have. One teacher that we talked to, she said that she and some others had gone to their supervisor to express concern about holding in-person classes, saying that they felt like it should move more so towards Zoom. They told me that supervisor then, in their words, passive-aggressively forwarded an email to all of the other teachers from a parent of an out-of-state student saying, my child didn't fly across the country to do classes with Zoom. Other students, or other teachers, and they've sent us anonymously a number of internal emails. They say they have been threatened and warned by deans at this school to not talk about the number of COVID cases in their classes, even in general nondescript terms, and they've been really frustrated about that. One teacher that we spoke to, he said he was speaking out to us because he felt like he had tenure, he was in a position to speak out and not be retaliated against, where other teachers, teaching assistants feel like they can't do that. He said that this plan, while it may have been well-intentioned to begin with, has not worked, and he believes it's time for the school to close. Listen here.
And I feel like we've been very, very transparent in terms of being open and responsive to questions that have come forward. And we hope that people will continue to utilize those avenues to talk to us directly, so that we can be responsive and help them to, better understand our circumstances as we see things from a big picture perspective.
I think the biggest concern that I have is that once it started breaking down, there's a refusal by administrators to admit that it's not working. I don't think the university right now is looking out for the community's best welfare, or the students' best welfare right now. It's about keeping it open no matter what.
So that first person you heard, the first person you heard from there is a vice president here at the school, and he was responding to questions about those teachers saying that they felt like they were intimidated and not able to speak out and criticize some of what's happening here on campus. The second person you heard from, that is the tenured professor. He also told me, interestingly, he told us that he didn't feel like the school should just close and send everyone home, that wouldn't be safe. He said what they should do is they should do a staggered departure and then keep students on campus who have been confirmed to have COVID-19 or have been in close contact with someone else who has it, and keep them here in isolation until they no longer have it and are safe to travel at the university's expense. For now, though, Savannah, it seems like the university has no plans to kind of change course or cancel classes or send any students home. Savannah?
All right, Ellison, just the ongoing back and forth of what to do about schools. Thank you so much.
You bet.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.